Picture this. You're doing everything your doctor told you to do. Taking your medications on schedule, checking your blood sugar regularly, watching what you eat, but you still feel exhausted by mid-afternoon. Your feet tingle at night. Your memory seems foggy. What if I told you the missing piece might not be about your medication dose or your carbohydrate intake at all? If you're over 50 and managing diabetes, there's a critical factor that often gets overlooked in routine doctor visits. We're talking about specific nutrient deficiencies that can make every aspect of diabetes harder to control. I'm going to share 3 vitamins that research shows many people with diabetes run dangerously low on, and more importantly, what happens when you're deficient and how to fix it. Before we begin, let me be absolutely clear. This information is meant to educate, not replace your doctor's guidance. Never start supplements without discussing them with your healthcare provider, especially if you're taking diabetes medications or blood thinners. Some vitamins can interact with medications, so professional oversight is essential. Here's something most people don't realize about diabetes. The condition itself creates a perfect storm for vitamin deficiencies. High blood sugar changes how your body absorbs nutrients. Frequent urination, which many diabetics experience, flushes water-soluble vitamins out of your system before your body can use them. Some diabetes medications, while life-saving, interfere with how your body processes certain vitamins. And the chronic inflammation that comes with diabetes increases your body's demand for specific nutrients. Think of vitamins as the workers in a factory. Your body is constantly producing energy, repairing tissues, and maintaining organ function. If you don't have enough workers showing up for their shifts, production slows down, things start breaking, quality suffers. That's what happens when you're vitamin deficient. Your body tries to keep going, but it can't perform optimally. Let's start with a vitamin that affects far more than most people realize. We're talking about the sunshine vitamin. Now, you might be thinking, I've heard about this one before. Everyone talks about it for bone health. But for people managing diabetes, this vitamin does something far more significant. It directly influences how well your insulin works. Here's what happens at the cellular level. Your pancreas, the organ responsible for producing insulin, has special receptors that respond to this vitamin. When you have adequate levels, these receptors help your pancreas release insulin more efficiently. The vitamin also helps your muscle and fat cells become more sensitive to insulin, meaning they respond better to the insulin your body produces or that you inject. Research has explored the connection between low levels of this vitamin and insulin resistance. People with insufficient amounts tend to have higher fasting blood sugar and worse overall glucose control. But the effects go beyond blood sugar. This vitamin acts as a powerful anti-inflammatory agent, and since diabetes creates chronic inflammation throughout your body, you need all the anti-inflammatory support you can get. The inflammation issue matters tremendously. Chronic inflammation damages your blood vessels, which is why people with diabetes face higher risks of heart disease, kidney problems, and vision loss. By helping control inflammation, adequate levels of this vitamin may offer some protection for these vulnerable systems. Now let's talk about why so many people with diabetes run low on this particular vitamin. First, the body makes it when sunlight hits your skin, but if you're over 50, your skin doesn't produce it as efficiently as it did when you were younger. Many older adults also spend less time outdoors. You might avoid the sun to protect your skin from aging or skin cancer risk. You might have mobility limitations that make it harder to get outside regularly. The diabetes connection adds another layer of complexity. Some research suggests that insulin resistance might interfere with how your body activates and uses this vitamin. It's a frustrating cycle. Low levels contribute to insulin resistance, and insulin resistance makes it harder to maintain adequate levels. Certain diabetes medications can also affect your levels, though the research on this is still developing. And if you're carrying extra weight, which many people with type 2 diabetes do, fat cells can actually trap this vitamin, making it less available for your body to use. How do you know if you're deficient? Your doctor can order a simple blood test that measures your levels. The test looks for a specific form called 25-hydroxy, which tells you how much is stored in your body. Most experts agree that levels below 30 nanograms per milliliter indicate deficiency, though some argue that optimal levels for people with diabetes should be higher. But even before getting tested, your body sends signals. Persistent fatigue is one of the most common complaints. We're not talking about feeling tired after a busy day. This is bone-deep exhaustion that doesn't improve with rest. You might notice your muscles feel weaker than they used to. Some people experience aching in their bones or joints that they can't quite explain. Wounds might heal more slowly than normal, which is already a concern for people with diabetes. You might catch colds or infections more frequently because this vitamin plays a crucial role in immune function. Some people report mood changes, feeling more down or anxious than usual. Brain fog and difficulty concentrating can also signal low levels. The consequences of long-term deficiency extend to every major system in your body. Your cardiovascular system takes a hit. Low levels are associated with higher blood pressure and increased risk of heart disease. The small blood vessels in your eyes can suffer additional damage, potentially worsening diabetic retinopathy. Your kidneys, already working overtime if your blood sugar has been high for years, may struggle more without adequate levels of this protective vitamin. Nerve health is particularly concerning. Diabetic neuropathy, that tingling, numbness, or burning pain in your feet and hands, may worsen when you're deficient. This vitamin appears to play a role in nerve protection and repair, so maintaining adequate levels becomes crucial for preserving nerve function. So how do you increase your levels? Sunlight is the most natural source, but it comes with caveats. If you can safely spend 10 to 15 minutes in midday sun a few times per week with your arms and legs exposed, your body can produce significant amounts. However, if you have a history of skin cancer, or you're taking medications that make your skin more sensitive to sun, this approach might not be appropriate for you. Food sources provide another option, though it's challenging to get enough from diet alone. Fatty fish like salmon, mackerel, and sardines contain substantial amounts. A 3-ounce serving of cooked salmon provides about 400 to 500 international units. Cod liver oil is exceptionally rich, with a tablespoon providing over 1,000 international units. But let's be honest, not many people enjoy taking cod liver oil straight. Egg yolks contain smaller amounts, about 40 international units per egg. Some mushrooms, particularly those exposed to ultraviolet light during growing, can provide decent amounts. You'll see labels on some mushroom packages specifically mentioning vitamin D content. Fortified foods like milk, orange juice, and some cereals have added vitamin D. But check labels carefully, since sugar content in fortified juices and cereals can be problematic for diabetes management. For many people over 50 with diabetes, food and sun exposure aren't enough to maintain optimal levels. This is where supplementation becomes important, but it requires careful consideration. Supplements come in two forms, D2 and D3. Research suggests D3 is more effective at raising and maintaining blood levels. Dosing matters significantly. Some people need 1,000 international units daily, while others require 2,000 or even more. Your doctor should determine the right dose based on your blood test results, your current levels, your weight, and other health factors. Taking too much can cause problems, including calcium buildup in your blood, so more is not necessarily better. If you decide to supplement, take it with a meal that contains some fat. This vitamin is fat-soluble, meaning your body absorbs it better when fat is present. Some supplements combine it with vitamin K2, which helps ensure calcium goes to your bones instead of depositing in your arteries. This combination might be particularly beneficial for people with diabetes who face elevated cardiovascular risk. One more important point about this vitamin: some foods and substances can interfere with how your body uses it. Excessive alcohol consumption impairs your liver's ability to activate it. Your liver converts the vitamin into its active form, so liver damage from any cause, including fatty liver disease, which is common in people with type 2 diabetes, can affect your levels. Highly processed foods that promote inflammation may indirectly worsen your body's ability to use this vitamin effectively. And certain medications, including some cholesterol-lowering drugs and steroids, can interfere with vitamin D metabolism. If you're taking multiple medications, which many older adults with diabetes are, talk to your pharmacist about potential interactions. Now let's move to a second critical vitamin that many people with diabetes don't get enough of. This one is particularly important for your nervous system and your blood cells. If you've been experiencing tingling in your feet or hands, unusual fatigue, or memory problems, this deficiency might be contributing. Here's the challenge with this vitamin. Your body needs stomach acid to extract it from food. As you get older, your stomach naturally produces less acid. This is just part of aging for many people. But for people with diabetes, additional factors compound this problem. If you're taking metformin, which is one of the most commonly prescribed diabetes medications, that drug interferes with absorption of this vitamin in your intestines. Research has shown that long-term metformin use can significantly reduce levels of this vitamin. Some studies suggest that up to 30% of people taking metformin develop deficiency over time. The longer you've been on the medication, the higher your risk. And if you're also taking medications that reduce stomach acid, like proton pump inhibitors for heartburn or reflux, your absorption becomes even more compromised. This vitamin does something absolutely critical in your body. It helps create red blood cells, the cells that carry oxygen throughout your system. Without enough of it, your body can't make red blood cells properly. They become larger than normal and fewer in number. This condition, called megaloblastic anemia, leaves you feeling exhausted because your tissues aren't getting adequate oxygen. But the effects go far beyond blood cells. This vitamin is essential for maintaining the protective coating around your nerves, called the myelin sheath. Think of it like the insulation around electrical wires. Without proper insulation, signals don't transmit correctly. When you're deficient in this vitamin, your myelin sheath can break down, leading to nerve damage that may become permanent if left untreated. For people with diabetes who already face nerve damage from high blood sugar, a deficiency in this vitamin creates a double assault on the nervous system. You might experience worsening neuropathy symptoms. The tingling or numbness might spread to more areas. Some people develop balance problems because the nerves that help you sense where your feet are in space become damaged. Cognitive effects can be significant and sometimes alarming. People with deficiency often report brain fog, difficulty concentrating, and memory problems. In older adults, severe deficiency can mimic dementia symptoms. Some people have been misdiagnosed with early Alzheimer's disease when their real problem was a vitamin deficiency that could have been easily corrected. The cardiovascular implications are serious as well. This vitamin helps break down an amino acid called homocysteine. When you don't have enough of the vitamin, homocysteine levels rise. Elevated homocysteine damages blood vessel walls, promotes inflammation, and increases blood clotting. All of these effects raise your risk of heart attack and stroke, risks that are already elevated if you have diabetes. Your mood can suffer too. This vitamin is involved in producing neurotransmitters, the chemical messengers that regulate mood. Deficiency has been linked to depression and anxiety. If you've been feeling unusually down or anxious and can't quite figure out why, low levels of this vitamin might be playing a role. How do you know if you're deficient? A blood test can measure your levels directly. Your doctor might also check methylmalonic acid and homocysteine levels, which tend to rise when you're deficient. These additional tests can catch deficiency in its early stages before symptoms become severe. Warning signs include persistent tiredness that doesn't improve with rest. You might feel weak or dizzy. Some people experience shortness of breath with minimal exertion because their blood isn't carrying oxygen efficiently. A smooth red tongue can be a sign. Some people notice their skin looks paler than usual. Neurological symptoms are particularly important to watch for. Besides the tingling and numbness in your extremities, you might have difficulty walking or maintaining balance. Your reflexes might become slower. Some people experience shooting pains in their limbs. If you notice any of these symptoms, especially if you're taking metformin, talk to your doctor about checking your levels. Where do you find this vitamin in food? It only exists naturally in animal products. Plants don't contain it, which is why vegetarians and vegans face higher deficiency risk. For people eating animal products, the richest sources are organ meats, particularly liver. 3 ounces of beef liver provides an extraordinary amount, far more than you need in a day. If liver doesn't appeal to you, and frankly, many people don't enjoy it, shellfish are excellent sources. Clams are particularly rich. A 3-ounce serving of cooked clams can provide more than your entire daily requirement. Oysters and mussels also contain substantial amounts. Fish, especially salmon, trout, and tuna, provide good amounts. A 3-ounce serving of cooked salmon gives you roughly half of what you need for the day. Beef, particularly lean cuts, contains decent amounts. Chicken and turkey have some, though less than red meat. Dairy products, including milk, yogurt, and cheese, contribute smaller amounts. Eggs provide some, found primarily in the yolk. For people who don't eat animal products or who have trouble absorbing this vitamin from food, fortified foods can help. Some breakfast cereals, plant-based milks, and nutritional yeast are fortified with it. Check labels to confirm fortification and to see how much is provided per serving. However, if you're taking metformin or you have absorption problems, food sources might not be enough. This is where supplementation becomes necessary. The vitamin comes in several forms. Cyanocobalamin is the synthetic form found in most supplements and fortified foods. Your body must convert it into active forms before it can use it. Methylcobalamin is one of the active forms. Some research suggests it might be better absorbed, particularly for people with absorption issues. Sublingual forms, tablets or lozenges that dissolve under your tongue, bypass the digestive system entirely. This can be advantageous if stomach acid or intestinal absorption is your problem. For people with severe deficiency or significant absorption issues, your doctor might recommend injections. These deliver the vitamin directly into your bloodstream, completely bypassing absorption problems. Some people need monthly injections indefinitely, while others can switch to high-dose oral supplements once their levels are restored. Dosing varies widely depending on your situation. A maintenance dose for someone with mild deficiency might be 1,000 micrograms daily. Someone with more severe deficiency or absorption problems might need much higher doses, sometimes 5,000 to 10,000 micrograms daily, at least initially. This vitamin is water-soluble, meaning your body excretes excess amounts in urine. It's considered very safe, even at high doses, with minimal risk of toxicity. However, it's still wise to work with your doctor to determine the appropriate dose for your situation. Some substances and habits can worsen deficiency or interfere with absorption. Excessive alcohol damages your stomach lining and interferes with absorption. If you're drinking heavily, addressing alcohol consumption becomes part of fixing the deficiency. Smoking may also affect how your body uses this vitamin, giving you one more reason to quit if you currently smoke. Acid-reducing medications, which many older adults take for heartburn, directly impair absorption because you need stomach acid to extract the vitamin from food. If you're on these medications long-term, monitoring your vitamin levels becomes especially important. Let's discuss the third essential vitamin that people with diabetes frequently lack. This one is crucial for cell repair, DNA production, and keeping inflammation under control. It works closely with the vitamin we just discussed, and deficiency in one often means deficiency in the other. This vitamin exists in two main forms in supplements and fortified foods. One is synthetic and requires your body to convert it into its active form. However, a significant percentage of people, possibly as many as 40 to 60%, have a genetic variation that makes this conversion inefficient. For these individuals, taking the synthetic form doesn't help much because their bodies can't process it properly. The active form, which your body can use immediately without conversion, is called methylfolate. If you're going to supplement, choosing methylfolate makes sense because it works for everyone, regardless of genetic variations. Why is this vitamin so important for diabetes management? It plays a central role in keeping homocysteine levels in check, just like the previous vitamin we discussed. Remember, elevated homocysteine damages blood vessels and increases cardiovascular risk. Since you need adequate amounts of both vitamins to control homocysteine, having a deficiency in either one or both creates serious problems. This vitamin is also essential for producing red blood cells. Deficiency leads to a type of anemia similar to what occurs with B12 deficiency, leaving you feeling exhausted and weak. Your body needs it to repair and create DNA, which means every cell in your body depends on adequate supplies for proper function and regeneration. For people with diabetes, nerve health is a constant concern. This vitamin contributes to nerve protection and repair, working alongside B12 to maintain the myelin sheath around nerves. Without enough of it, neuropathy symptoms may worsen over time. The vitamin also influences inflammation levels throughout your body. Diabetes creates chronic low-grade inflammation that damages organs and blood vessels. Adequate levels of this vitamin help modulate inflammatory responses, potentially offering some protection against diabetes complications. Why do people with diabetes tend to run low? High blood sugar creates oxidative stress, which increases your body's demand for this vitamin. Your body uses it up faster when dealing with inflammation and cellular damage. Metformin, once again, interferes with absorption. The medication affects the same part of your intestines where this vitamin is absorbed, creating similar problems to those we discussed with B12. Frequent urination flushes water-soluble vitamins, including this one, out of your system. And if your diet is heavy in processed foods and light on vegetables, you're simply not consuming enough to meet your body's increased needs. Deficiency symptoms overlap considerably with other conditions, which is why it often goes unrecognized. Fatigue is common. You might feel weaker than usual, or notice that everyday tasks require more effort. Some people experience shortness of breath because of anemia. Your tongue might become sore or swollen. Digestive issues can occur, including loss of appetite, weight loss, or diarrheal. Neurological symptoms include numbness, tingling, or difficulty maintaining balance. Mood changes, particularly depression and irritability, can signal deficiency. Some people report difficulty concentrating or memory problems. A blood test can measure your levels directly, though testing isn't always standard unless you're showing symptoms or have risk factors. If you're taking metformin long-term, eating a diet low in vegetables, or experiencing any of the symptoms we've discussed, asking your doctor to check your levels makes sense. Where do you find this vitamin naturally? Leafy green vegetables are the richest sources. Spinach, kale, collard greens, and turnip greens all contain substantial amounts. A cup of cooked spinach provides well over half of your daily needs. Lentils and beans are excellent sources. 1 cup of cooked lentils gives you nearly all of what you need for the day. Asparagus is particularly rich. Brussels sprouts, broccoli, and avocados all contribute decent amounts. Oranges and orange juice contain some, though remember that fruit juice can spike blood sugar, so whole fruit is a better choice for people with diabetes. Eggs provide some, found in the yolk. Beef liver, once again, tops the list of animal sources. 3 ounces of cooked beef liver provides several times more than your daily requirement. If you don't eat liver regularly, which most Americans don't, focusing on leafy greens and legumes becomes important. Many foods are fortified with the synthetic form. Breakfast cereals, bread, pasta, and rice in the United States are often enriched. While fortified foods can contribute to your intake, remember that many of these are high-carbohydrate foods that may not fit well into a diabetes-friendly eating pattern. If you need to supplement, and many people with diabetes do, choosing the right form matters. Look for methylfolate rather than folic acid on the supplement label. Common names include L-methylfolate, 5-MTHF, or metabolon. These indicate the active form that your body can use directly. Typical supplemental doses range from 400 to 1,000 micrograms daily. Your doctor might recommend higher doses if you're significantly deficient or if you have the genetic variation that impairs conversion. This vitamin is also water-soluble and generally considered safe, even at higher doses. But working with your healthcare provider ensures you're taking an appropriate amount. Some foods and substances can interfere with how your body absorbs or uses this vitamin. Alcohol impairs absorption and increases how quickly your body excretes it. Heavy alcohol consumption is a risk factor for deficiency. Some medications, including certain anticonvulsants and some antibiotics, can interfere with folate metabolism. Highly refined grains lose most of their natural folate content during processing. Even though they're often fortified afterward, you're getting the synthetic form that not everyone can use efficiently. Choosing whole grains when appropriate for your carbohydrate budget, or focusing on non-starchy vegetables as your primary source, makes nutritional sense. Let me tie all of this together. If you're over 50 and managing diabetes, you face unique nutritional challenges. Your body's ability to absorb nutrients changes with age. Diabetes itself affects nutrient metabolism. Medications that help control your blood sugar can interfere with vitamin absorption. And the complications of diabetes, from nerve damage to kidney stress, increase your body's demands for certain nutrients. These 3 vitamins, the sunshine vitamin, B12, and folate, form a foundation for protecting your nerves, supporting your cardiovascular system, maintaining your energy levels, and helping your body manage inflammation. They work together, which means deficiency in one can worsen the effects of deficiency in another. Getting your levels tested is the first step. Don't assume you're fine because you eat a decent diet or because you're not experiencing obvious symptoms. Deficiencies can be subtle for years before they become severe enough to cause recognizable problems. By that point, some damage may already be done. Work with your doctor to determine whether supplementation is appropriate for you. Not everyone needs supplements, but many people with diabetes do. Your doctor can help you choose the right forms, determine appropriate doses, and monitor your progress with follow-up testing. Pay attention to food sources as well. While supplements can fill gaps, getting nutrients from whole foods provides additional benefits. Foods come packaged with other vitamins, minerals, and compounds that work together synergistically. A piece of salmon gives you not just B12, but also omega-3 fatty acids and high-quality protein. A cup of spinach provides not just folate, but also magnesium, iron, and antioxidants. Consider your medications and how they might affect your nutritional status. If you've been taking metformin for years, proactive monitoring of B12 and folate makes sense even if you feel fine. If you're on acid-reducing medications, your doctor should know this when assessing your vitamin absorption. Think about lifestyle factors too. Are you getting any sun exposure? Are you drinking more alcohol than you should? Are you eating vegetables regularly or relying heavily on processed foods? Small changes in habits can have meaningful impacts on your nutritional status over time. Remember that managing diabetes is a marathon, not a sprint. You're in this for the long haul, which means protecting your body from complications becomes paramount. Maintaining adequate vitamin levels is one piece of that larger puzzle. It's not flashy or dramatic. You won't see immediate results the way you might with a blood sugar meter. But over months and years, proper nutrition supports better outcomes and helps you maintain your quality of life. I want to hear from you in the comments. Have you had your vitamin levels checked? Have you experienced symptoms that might indicate deficiency? What foods from the lists we discussed do you already eat regularly? Share your experiences because they might help someone else who's facing similar challenges. If you found this information valuable, please click the like button. It helps other people discover this content when they're searching for ways to better manage their diabetes. Share this video with someone who might benefit, whether that's a family member, friend, or someone from your support group. Make sure you're subscribed to this channel so you don't miss future videos on diabetes management, nutrition, and healthy aging after 50. We're committed to providing practical, evidence-based information that helps you take control of your health. Managing diabetes requires attention to so many different factors: medications, blood sugar monitoring, exercise, stress management, and yes, nutrition all play important roles. It can feel overwhelming at times, but knowledge gives you power. Understanding why these vitamins matter and what you can do to maintain adequate levels puts you in control. You deserve to feel energetic, clear-headed, and strong. You deserve to protect your nerves, your heart, your vision, and your kidneys from preventable damage. Paying attention to these 3 vitamins is one way to do that. It's not the only thing that matters, but it's an important piece of your overall diabetes management strategy. Take this information to your next doctor's appointment. Ask about testing your levels. Discuss whether supplementation makes sense for your situation. Look at your diet and identify opportunities to add more vitamin-rich foods. These are concrete steps you can take this week that may benefit your health for years to come. Remember, this journey is personal. What works for one person might need adjustment for another. Your doctor knows your complete medical history, your current medications, and your individual risk factors. Use this information as a starting point for conversation, not as a prescription to follow without professional guidance. You're doing important work managing your diabetes every single day. Every healthy choice you make matters. Every conversation you have with your healthcare team contributes to better outcomes. And every bit of knowledge you gain helps you make more informed decisions about your health. Keep going, stay curious, and take care of yourself. You're worth the effort.